So what we're going to do today is just show the basic process we go through when desexing a dog. So we've got the nurses here just putting her onto a drip. You can see she's a little cutie, but sometimes these little veins can be a little bit tricky, so we'll forgive Mel if she doesn't get it first time. So there's quite a few advantages to putting dogs onto a drip. Big ones are it helps maintain their blood pressure during surgery, because it's been proven that over 2/3 of dogs would experience some degree of hypotension during surgery, and around half of those dogs it's going to be actually quite dangerously low their blood pressure, which puts them at risk of kidney damage and liver damage and sort of multiple other organ problems, as well as increasing the risk of infections and slowing healing time. So it's quite important. The other things that it does is it really speeds up the recovery time, and you'll see how quickly she kind of seems to recover from the anaesthetic. And rather than the old days of dogs staggering out the door, still half asleep from the anaesthetic, we really expect them to be walking out quite bright. But also the other thing it does is just if we have an emergency during surgery, it means that we've already got access to the veins. So if we need to give extra fluids because we have a bleed, or if she has some sort of reaction and needs some medication, then we've got instant access to a vein. But you can see it's quite painless getting the drip in. She's tolerated it very well. And yeah, so she's having a little bit of a squirm now. But once we've done this, we'll give her a bit of pre-medication just to reduce the stress levels and get her ready for the surgery. And then in around half an hour's time, we'll start the surgery on her. So another advantage of having the IV line in is all our injections can actually just go in through that line. So instead of having to fill multiple needles through the morning, then we just have the one needle going in to get the drip line in, and then it's all nice and easy. So as you can see, Meg's sedation has worked quite well. She's pretty relaxed and ready for a surgery now. So we're about to give her full anaesthetic, which is going to put her to sleep completely. We'll get her prepared out here and then we'll take her through into surgery. But as you can see, it's a pretty relaxing sort of experience for her when you give the right medication and do things nice and calmly. So we've got Meg's through into theatre now. We've got her hooked up to all our machines. So our monitoring equipment here, that measures her heart rate, measures her breath carbon dioxide, which measures how effectively she's breathing and how effectively she's metabolising. So that gives us a good indication of if there's a problem. We measure the blood oxygen levels, measure the blood pressure, and we measure the temperature as well, just to make sure they're a good constant temperature, because getting too cold also affects recovery from the anaesthetic. You can see we've got her on the drip pump to keep the fluid going in, and we've got the nice warm air blanket. So that's putting air over her at around 40 degrees, so it's got her nice and comfortable in there, and it's going to help protect her body temperature as we go. So you can see when we're doing surgery, we wear our scrub suits. When we're doing consults in our normal clothes, we obviously get quite a lot of hair and dirt on it. And the last thing you want to do is introduce that into a sterile surgery. We're really big on not actually using antibiotics during our routine surgeries. There's still some vets that will give antibiotics during routine surgeries, but we think that it's unnecessary if you have good levels of sterility. So yeah, we just make sure we scrub well, wear our hats and masks so that we don't have hair drop into the wound and don't come and breathe in any germs into the wound. And by just having really good levels of sterility, it reduces the risk of post-operative infection and reduces our antibiotic use. So once I've finished scrubbing, I'll hop on a gown and gloves, and then we'll go ahead and do the surgery. We're ready to go with Meg's surgery, so I won't actually show you the procedure because really you don't want to see that. But you can see we've got nice sterile drape. We use disposable drapes here because they're, once again, lowers the risk of infection, but actually it's more environmentally friendly. It's been shown to use disposable drapes than to use the cloth ones, which we have to wash and autoclave separately here. So these have all been sterilised. You can see you've got gloves and gowns, so just the same as you'd expect in a human theatre. So we'll go ahead and do the surgery now, and we'll show you what Meg's looks like afterwards. So we've just finished the surgery. Mel's just doing the sterilisation tattoo on the ear. This is the surgery site. So you can see for a dog this size, it's a pretty small incision. It's not much longer than my finger is wide. And this is what we've taken out. If you feel a bit queasy at the sight of blood, just look away briefly. But this is what a dog's uterus looks like. So we've got the 2 ovaries and the uterine horns. So this is why the dogs can have lots of puppies. So they basically line up along those uterine horns, and yeah, they can have, up to 10 or 12 puppies, sometimes all lined up along there. But with a dog this size, you can see it's pretty small, so we'd normally expect a dog this size to be able to have maybe 5 or 6 puppies. But we'll wake her up now from her anaesthetic, and we'll show you what she looks like afterwards. So here's Meg's recovering from her surgery. So you can see pretty relaxed, nice and comfortable in her kennel. We'll keep a pretty close eye on her for the next half hour or so, just until she can sit up and maintain her own airway kind of very effectively. And then once she's awake enough, she'll be right to go home. So this is Meg's less than 2 hours after her surgery, and you can see she's already out and about and yeah, looking pretty bright and happy. She's off her drip and she's pretty much ready to go home. We've got a collar on her just so she can't lick a wound, because dogs being dogs, they like to have a bit of a lick at these things. And yeah, you can see, like I said before, one of the advantages of fluids, it's not just about safety, but it's also about a quick recovery. And you can see that less than 2 hours later, she's pretty much back to normal. We've got plenty of pain relief on her, in her, so she's comfortable and she's ready to go home now.